Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Everyone has entered this meeting on mute, but we will have a discussion at the end of this webinar. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. And you can also raise your hand to request to be unmuted to ask your question out loud. Today's discussion is the first in a two-part series on sepsis. Today, we'll be discussing sepsis from an infection preventionist's perspective, and next week, we'll be discussing it from a medical perspective. That discussion will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guest today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, thank you for joining us again today.
Thank you, Kathy. Good afternoon, everyone. As Kathy mentioned, today's presentation will begin our series of two webinars on sepsis. Today's talk will be about sepsis from an infection control perspective. Sepsis can and does affect people of all ages, but today we will discuss sepsis in nursing homes, as we have found that it is one of the top diagnoses for hospital readmission among our participating nursing homes. During next week's webinar, our medical director, Dr. Jean Storm, will discuss treating sepsis in the early stages. So now we'll talk a little bit about sepsis. The Centers for Disease Control and Prevention estimates that 1 to 3 million serious infections occur in long-term care settings every year. Many residents of long-term care settings are older adults with chronic conditions. Both are risk factors that can increase the risk of infection. These risk factors also increase the risk of infections progressing to sepsis. So what exactly is sepsis? Sepsis is a condition which sometimes is incorrectly called blood poisoning. It is the body's extreme response to an infection that can lead to tissue damage, organ failure, and death. Sepsis is a life-threatening medical emergency. Residents living in long-term care facilities enjoy many benefits, including opportunities to interact with other residents and visitors, and even facility employees. However, the more people who come and go, there's an increased risk for certain types of illnesses to be brought into and spread throughout the facility. Infections developed within a hospital or long-term care facilities are called healthcare acquired infections, or HAIs. Some infections can become so serious that residents may need to be transported and/or admitted to a hospital if they become too ill for the long-term care facility to handle. If an infection is not recognized and treated, or if the antibiotics are not effective, as can be the case if it is an antibiotic-resistant bacteria, sepsis can develop. Some common antimicrobial-resistant organisms seen in long-term care facilities include MRSA, C. diff, and VRE. Some common infections that are often seen in long-term care facilities include pneumonia, urinary tract infections, or UTIs, gastrointestinal infections, wound infections, and vascular access device associated infections. So let's talk a little bit about respiratory infections. Respiratory infections, such as pneumonia, account for 35% of sepsis cases. Residents who come in contact with others who have a viral or bacterial respiratory illness may develop a respiratory infection. Also, residents with difficulty swallowing are at risk for inhaling foods or drinks, which could lead to aspiration pneumonia. Urinary tract infections, or UTIs, can typically be managed safely and effectively when they are identified and treated quickly. An untreated UTI may spread to the kidney and can also cause sepsis. Some risk factors of developing urinary tract infections include being a female. While females are more likely than males to develop UTIs, people with external genitalia are still at risk for UTIs, though they may not be as aware of this risk or familiar with the symptoms of urinary tract infections that would lead them to seek prompt care. Ineffective hygiene practices, such as improper bathing techniques or catheter care, or the prolonged use of urinary catheters. Residents also face increased risk of infection due to the treatments they receive at the facility. Chronic invasive devices can be a portal of entry into the body, which can lead to an infection. The following chronic invasive devices can be a source of infection: ventilator tubing, access ports, or IVs. Wounds can also be a common source of infection. Residents with frail skin can develop conditions which could become infected, such as scratches or fissures, skin tears, wounds, or pressure ulcers. As healthcare providers, we can work together to help prevent these infections before they progress to sepsis. Some activities that may help prevent the spread of infection include hand hygiene. Hand hygiene is an important way to prevent the spread of infection. Be sure to wash hands or use alcohol-based hand rubs when moving between residents to provide care. Effectively isolate and/or cohort residents if they show signs of illness or a confirmed infection. When residents are placed in isolation, ensure that isolation protocols and the use of proper PPE, such as gloves, gowns, and/or masks when required, are observed. And ensure that rooms and objects are clean as per your facility's protocol. Facilities can also work to develop policies and procedures for staff, residents, and visitors, including encouraging visitors to wait if they are not well, and encouraging visitors to perform hand hygiene upon entering the facility. Educate residents and their families about managing chronic conditions that put residents at higher risk for infections and sepsis. And encourage residents and their families to stay up to date with appropriate vaccinations. Encourage proper nutrition for residents. Malnutrition is the primary cause of immunodeficiency worldwide and can make residents more susceptible for infection. Ensure wounds are kept clean and dressings are maintained as ordered. And educate staff and perform competencies on catheter care, competencies on IV sites, which could include site assessment and strategies for reducing the risk of infection, and on injection safety. Facilities can also provide education for staff on signs and symptoms of sepsis, which include elevated heart rate, weak pulse, confusion or disorientation, extreme pain or discomfort, fever or chills, shortness of breath, or clammy skin. So why is it so important? These interventions are so important because sepsis is a medical emergency and develops quickly. Sepsis can cause irreversible damage, including death, if not treated early. And with prompt recognition of symptoms and early treatment, most residents survive. In most cases, a resident who is suspected to have sepsis will need to be transferred to a hospital to receive intensive evaluation and treatment. With early recognition and treatment, long-term care professionals can improve the outcomes of residents with infections and sepsis and help save lives. This is a printable resource developed by the CDC that may be helpful, entitled 4 Ways to Get Ahead of Sepsis. It goes over strategies on how to prevent infections, practice good hygiene, and familiarize yourself with symptoms of sepsis, and also when to act. Thank you all very much for joining us today to discuss sepsis in long-term care. Next week, we will continue this series with Dr. Storm to discuss sepsis detection and treatment of sepsis in the early stages. At this time, I can take any questions you all may have about sepsis prevention. Thank you very much.
All right, thanks, Jen. So in a moment, we'll begin the Q&A portion of this meeting. If you have a question or comment, please share them using either the chat or the Q&A tools in your Zoom menu, or again, you can raise your hand to request to be unmuted. And while we're waiting, I'd again like to invite everyone to next week's webinar, which will be the same time and place, Wednesday at 2 p.m. You can register using the same link that you used to register for today's webinar. We also invite you to bring your questions to our virtual live chats, which are each Tuesday and Thursday at noon. Deborah Wright will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. And you can find the link to join those live chats and our webinar email reminders, to join those live chats in our webinar email reminders, as well as our Friday newsletter, the Last Minute Lowdown. And if you're not on the mailing list to receive that newsletter and our webinar reminders, but you would like to be, you could email me at caudill@qualityinsights.org and I will add you to our mailing list. And I will drop my email in the chat shortly along with Jennifer's. All right, looks like we don't have any questions so far. We'll take a few more minutes for people to submit questions if you have them. I also dropped in the chat the link to download that CDC PDF that Jen had on the screen just a minute ago.
Hi, this is Penny. I was just wondering if anyone listening in the audience, are you finding that are you all finding that sepsis is one of your top diagnoses, and has anybody drilled it down to identify which are the top infections that might be leading to sepsis? And then my second question is that an area that you're able to educate all of your staff on fairly easily, or would there be more resources that you might need? You can either raise your hand to speak up so we can unmute you, or just put something into chat. Because we're interested in learning more and seeing that that's such a top diagnosis. We wanted to learn a little bit more from all of you on what you're seeing. Hi, Jack. How are you today? Yeah, so you have a sepsis protocol. Well, yeah, if you're a long-term vent facility, you have a sepsis protocol in place.
Right,
That's
yeah.
good. Anyone else? How about education of frontline staff? Is that something that that you have information for? Is that anything that is a need that you might have identified?
Penny, if you like, I can read these comments out loud because we do have at least one
Oh,
caller.
that's right, because some people, this is recorded. Yeah, please go ahead. I'm sorry, I just tend to talk to.
Our first comment said, I'm at a long-term vent facility. Sepsis is a big reason people get hospitalized, but we do have a sepsis protocol. And the next comment says, it is a top diagnosis for our facility, and we have been working to educate staff on identifying changes faster. We could always use information for a quick in-service for frontline staff.
That's excellent. Thank you for the feedback.
And for anyone who doesn't know, Penny is one of our quality improvement specialists and is the head of our nursing home team here. I think everyone's met Penny at this point.
Yeah.
This comment says, I might do one after today. We do daily rounds during the week to look for S/S of anything that could be brewing in our residence.
Yeah, so they do daily rounds to look for signs and symptoms of anything that could be brewing for the residents. Kathy's our communication person, so sometimes our medical terminology abbreviations, she's not always quite sure what they are, but now she knows that means signs and symptoms.
I'm learning. I need to make myself a dictionary.
Yeah.
Jack, I have a question for you. For the daily rounds that you do, who's completing the rounds? Is it the infection preventionist, or is it someone from the frontline staff? Who's doing your rounds? Okay.
Well, that's yeah.
Infection preventionists, nurses, dietary and respiratory.
That's great. You know, one of the things that's really important is having, you know, the frontline staff trained in those signs and symptoms, because they're really your eyes and ears. That's great. Thank you.
And that really does show with that, Jack, when you're including all those other people. I like to see you have dietary in there, and that's great, because infection control, just like all QAPI processes, really do need to be all departments, all staff involved in understanding what to look for. And I'll tell you another one, like I know housekeeping was always, I'm telling you, the housekeepers, because they're in there and they're cleaning, and a lot of times some of the residents were in there and they'd be talking. I had housekeeping staff who could always tell me right away. I think they were excellent at identifying change in condition, sometimes quicker than the rest of us, because they would be in there and talking to the residents, and they'd come out and say, Mrs. So-and-so doesn't seem quite the same as what she usually did. So they were always really helpful too, from that standpoint.
Yeah.
All right. Do you think do you want to give it a couple more minutes, or go ahead and wrap us up?
Oh, I think we're good. Thank you.
Okay.
Thank you for the
Perfect.
feedback. And you all know, if you need anything, please reach out to us here at Quality Insights, to your individual quality improvement specialist. I'm sure I'll just let Kathy close it up.
Okay. Thanks. Yeah, and before we sign off, we'd like to ask everyone here to please answer a short questionnaire following the webinar. It will be anonymous, and it will be showing up as a pop-up as soon as I click this webinar to be over. And if you have a couple minutes to fill that out, we'd appreciate it. I'd like to thank you all for joining us this week. Jen, thank you for this great presentation, and we hope to see you all back here next week.
Thank you.
Thanks.